name is Dr. Rick Saguil.
And action. Hey, Jay, this is Kirk again. And action. Hey everyone, it's Dr. Rick. And Eddie had a question on microdosing medical cannabis. So for those of you in Illinois, I certify for medical cannabis, and there are two different cards to get. Those are certificates. The first card is the 90-day card, and the second card is the 1 to 3 year card. And they both get you into the dispensary, and there's benefits to the big one, but a little more expensive. But bottom line is that when patients come to me, I don't only just sign the form and get them away. I actually take about an hour to define exactly what I would do, what the medical problem is, how I would microdose. So I'm getting some of my 90-day card holders, like Ed, to come back in, and I'm finding that the suggestions that I initiated were not being followed, and that's okay, but if it's not being followed because the bud tenders don't have enough time to teach, or they don't agree with the way I subscribe to the use of medical cannabis, then I think there should be more teaching in the doctor realm. So any of you who are seeing doctors that have given you the certificate of approval, please ask them where to go, or come watch my videos, or have me consulted. I can certainly give you empowerment, but if you're going to be a really good cook, you have to know how to use your ingredients properly. And in this case, where the ingredients can actually help the outcome positively, the outcome of your disease process versus prescription medicines, which I think have a higher side effect profile and higher price, I'd rather go this route, but you unfortunately need more guidance, and it's not available. And I'll show you why in the studies that I came up with. I went to PubMed and I did a couple of lit searches and printed up a couple of things there. So hopefully after we're done, you can understand why microdosing is really important with this plant. So first study is out of Hopkins, and they essentially looked at the combination or the comparison between vape and flower. So for cannabis naive people, and this is not just for people who have disease, I think you can use this for everybody except pregnant women and maybe less than 18 years of age, because there's a little bit of a complicated history with those two groups. But I think for everybody else, regardless, you don't have to have cancer, you don't have to have arthritis. I think you can actually take care of, and you don't have to have PTSD or the other 52 other diagnoses that are approved by the state of Illinois. I think you can use it for a lot of things that the average American has. So the study from Hopkins was just comparing the vape to the flower. That was the objective. And they found the vape was stronger in symptoms because the THC, which is one component of the plant, will give you that psychoactive effect. And that's great for PTSD sufferers, for people that have insomnia, for people that have overwhelming anxiety. I think it's important. But the CBD is also in the plant too. CBD is it's a chemical that is bound mostly to the immune system, and it modulates the immune system. That's why it can be used for COVID if you happen to get an infection. But it also can be used for arthritis, for Crohn's disease, for fibromyalgia, for psoriasis or eczema. It can be used for mood as well. And we'll get to how that works in a second. I'm just going to tell you that bottom line is there's a lot of different products. But the study from Hopkins did show that the vape brought more symptoms, calm, and more of a blood level of the THC faster than the smoking of the flower. And it came on within 30 minutes and lasted for about 3 to 4 hours. So those two products alone, within the family of what you find at the dispensary, flower and vape, that's the two options already. Just those have two options for alleviating symptoms. Now, next study was how medical cannabis, this is from a chronic pain source. There's benefits to medical cannabis, positives that help with chronic pain. So the reason that the cannabis industry started to blossom and get approved for recreational in several different states was because of the opioid epidemic last year. And the last couple of years. But when the opioid epidemic started to take hold and you saw the statistics, and then death and disability, yet the cannabis users I mean, there's not one study that showed death from overdose of medical cannabis on Earth. That's pretty good compared to the deaths that you get with opioids. And if both of them work to control pain, why not use this one because it has less side effects? Oh, why? It's because it's Schedule 1. Schedule 1, it's still Schedule 1. Schedule 1 is deemed no usefulness and highly addictive, like LSD. That's ridiculous. So we're using it for, Canada made Epidiolex, it's CBD, mostly from hemp, but still it's CBD, and that shows it takes care of seizure, childhood seizure. There's Lennox-Gastaut and then Dravet syndrome in childhood unrelenting seizure, and CBD helps. THC helps. It's already been made in the United States for wasting from HIV and also chemotherapy-induced nausea, vomiting. So you have two reasons to use it. So that the fact that it's still Schedule 1 is not fair. That's politicians, and if you want this to get off Schedule 1 so we get more research, because until it gets off of Schedule 1, the United States can't produce research from major institutions because they are in fear of losing grants from the government when they start to do studies or research on Schedule 1 components, and that's just a shame. So vote properly. This is just a study that talked about using multi-dosing as a treatment plan. So the lower the daily use, the less the possible side effects. So THC does have side effects. So let me just mention that the inhaled versions of this plant can give more potential for side effects, mostly in the psychiatry, behavioral health field, like psychosis. If there is a history of schizophrenia in the past, sometimes you have to watch those patients too. It might bring on a schizophrenic episode. So short of that, usually the older population likes to take in edible. They don't like the smoking thing because we've been harangued as don't smoke for that generation. And so usually edibles do possibly produce side effects too, but they're not really behavioral, they're more symptoms. Upset stomach, nausea, headache, chest pain sometimes, but that's with overdose of edible. The overdose on the smoked or inhaled version is behavioral. But again, if we had more protocols and suggestions on how to use this beautiful plant in its multiple different options, then you might have less side effects. So that's why I have to make a plea that if you have been given a card in the state of Illinois, but you're not dialed in with microdosing, that essentially means CBD 2 to 3 times a day, THC is a rescue. I think that's important. The CBD is the one component. Now there's like 144 plus different components from this plant, which is spectacular. And all of them have great use. CBN, it doesn't give a psychoactive hit to you when you take it, but it does make you sleepy, which is awesome. CBD doesn't really have a psychoactive hit to it. It won't make you high, but it'll take care of inflammation. It'll take care of boosting your immune system, especially in COVID. It'll take care of modulating how the gut works. So this stuff works great. Eventually, I do think it does help with decreasing overall pain and helping with calming or stabilizing mood. More so than THC, which is typically psychoactive. And that's the relaxation part you get. Or the paranoia you get if you overdose. So with all those different options available in this one plant, I think it makes it very multidimensional. You think of one inhaler that you can also take a pill for. So there's albuterol inhaler for asthma rescues. There's not really a syrup or a pill. I mean, they do have albuterol in syrup form for kids, but there's a high side effect profile. It really gets you like this for a prolonged amount of time. And so you have to be careful with that. Or if you talk about a pill, an antibiotic, for most adults, antibiotics, high cholesterol medicines, high blood pressure medicines, there's like 2 to 3 different doses, 2 to 3 different milligram dose capsules. So you can't really multi-dose that. You can't really microdose that. I think that I'll present the final paper I'm going to show you is how the concept of microdosing has been around for a long time, but can't really do it with prescription medicines because they're fixed. I mean, you can't really open a capsule and say, I'm just going to take a little bit. And you can't titrate up your own dose. You're stuck with what the doctor and the pharmacist will give you. So, which unfortunately leads to polypharmacy, but we'll talk about that in a second. So let's see, this study just talked about, so people sometimes will go to the dispensary to figure it out with the bud tender. Bud tender, for those who are cannabis naive, bud tenders are the salespeople behind the counters at the dispensary. And bud tenders cannot come up with a diagnosis. They can only suggest what other people have used and make suggestions if you tell them some of your symptoms, I think. But the bud tenders, in a previous video I just did about 2 weeks ago, they only have 2.5 to 5 minutes to listen to your symptoms, make a suggestion, and have you move forward and have the next client come on in. That's sales. I mean, the place has to make money, I guess. So if 54.9% of the people going in rely on the bud tender, and the bud tender has that much time available, you're going to be getting the wrong information or lack of information. That's why you have to ask your doctor. So if the doctor that signed your certificate is available, ask that person. If the doctor doesn't want to tell you or give you some advice because he doesn't know anything, hire me or come to one of my lectures or check out my videos. Or read on Leafly, read Cannabis Pharmacy, read a couple different, the Cannabis Index. There's a couple different books that are out there, entry level or really sciencey, but read. If you're going to be a good cook, as I mentioned in the past, you really have to know your ingredients, and you have to plan on burning a couple dishes, but you'll get it, and you won't be spending that much money either, and you won't have any side effects. So next is, some people would be apprehensive. Usually it's my baby boomers. No offense, baby boomers. I'm actually at the tail end of a baby boomer decade, but I don't think the same as a boomer. Hey, boomer. The idea, though, is some of the apprehensive folks will go for CBD that you might find at the gas station or on Amazon or at Walgreens. That's usually from hemp. That has to be from hemp. When it's not sold via a prescription at a dispensary, or it's not sold has a medical cannabis product, it's hemp. CBD by itself is from hemp, as far as that label. And this study showed that between CBD and THC, you can have some effects with CBD, but the problem is a lot of the products out there don't have what is on the label is not in the product. So this study was to show that. So you have to be careful. You're going to be using CBD. You have to hope that the CBD has the active ingredient CBD in it, whatever it's a capsule, a pill, or vape. If it's not medical cannabis, bottom line is I have hemp owners. I'm sorry, but I would just go to dispensary. But there's some people who just can't do the medical cannabis, and that's why I'd say be very selective. Go to only the best, most local, well-known hemp stores in your area, and inquire. The owner will usually they should give you some good information. So this just, there's a research letter that found that 26% of the CBD that was found over the counter didn't have CBD in it. So buyer beware. This was information on canna vaping. So 2019, they had a lot of problems with vapes causing respiratory disease, getting people admitted to the hospital, and some deaths. That's theoretically canna vaping. That's when you take a nicotine cartridge and a system that with a burner or a battery and a wire, and you refill the little cartridge with whatever you want. And apparently some people were really juicing it up with cannabis somehow. I mean, I would have just gone to the medical cannabis dispensary, and I believe that's what we were going to find, but they never released the information. The CDC was looking into the cases and researching. They were supposed to release all that information fall of 2019, but nothing ever happened. So I don't know where that is. However, I do think that we have people who are apprehensive, and I would be very selective. But I still say that because people are finding, some of the lucky ones find that the canna vaping with the nicotine does help them, they're self-medicating. And if you're self-medicating, you might as well just go for the big stuff that's guaranteed to have the exact amount. That's the thing in Illinois is, not only do you have to have the amount of CBD, you have to have the percentage of THC, you have to have the type of terpene, you have to have it labeled and stickered. and the cultivator has to be on task for putting all that stuff on their product, and they have to be tested. So they have batch testing like they do with prescription medicines. Well, that's what the cannabis industry has to do too. So, so I think you're getting a good product. You just have to know how to use it. And this was, in fact, the pharmaceutical industry knows that you're getting a good product, and they're trying to reproduce the same thing you might get in a cannabis plant. So this was a study of B1A. It was something in France that was tested, or something in Portugal that was tested in France, and they found that halfway through the study, phase 1, the subjects were having brain bleeds. So it was a great concept, but it caused side effects. And truthfully, why not just forget the prescription cannabis, just do the real cannabis. That was FAA, a FA inhibitor blocker, I think, so never mind about that. But again, there's Epidiolex is a CBD-derived or hemp-derived CBD from Canada. It has been shown to help with pediatric seizures, specifically Dravet's and Lennox-Gastaut syndrome. So we know it helps. In addition, in Sativex in the United States, I believe, and another one, I don't remember the name of it, have been made for patients that have HIV wasting or chemotherapy-induced nausea and vomiting, intractable. So we know that the components of the hemp or the cannabis plant are medicinal and they're therapeutic, but for some reason, cannabis is still considered Schedule 1. Schedule 1, according to the schedules of drugs, and Schedule 1 is no benefit medically and high addictive value. That schedule designation is so old it has to be knocked off, but until they knock it and bring it down to Schedule 3, like hemp, they will not be able to get any great studies from institutions like Hopkins or Harvard or Stanford, because some of those universities, if they do things on Schedule 1 medicines or Schedule 1 components, they might lose funding for future research projects. So nobody's going to touch it. So vote properly. If you use this product, please vote and know what your politicians are doing. If you don't use this product, research, because I think it's really helpful. And I'm going to explain why I think it's going to be helpful for everybody else. So this study showed polypharmacy. I wanted to bring up the concept of polypharmacy. And polypharmacy is a common thing nowadays, unfortunately, especially as you get to 50, 60, and 70 years of age. I think at 50 years of age, most of my guys coming in for wellness have 5 medicines: blood pressure, glucose or prediabetes, high cholesterol, maybe a little erectile dysfunction, and then a problem with mood or sleep. So average 50-year-old will have those things. And then at 60, there'll be a couple more because they never took care of the root problems that caused the problems at 50. Then at 70, they'll have side effects to the medicines, and they'll have to have side effect medicine too. And then side effect to the side effect medicine. So if you don't take care of the root cause, so that's the concept of polypharmacy. That's the concept of polypharmacy. It's to take care of multiple medical problems, which unfortunately is a growing trend in the United States. You're having morbidities that are expanding as people get older. Some of the problems, as I mentioned, most of the problems have a specific pharmaceutical medicine for that problem. And if you think about what you can get with medical cannabis, can you lower blood pressure? Yes. Can you take care of pain? Yes. Can you take care of seizure? Yes. Can you take care of inflammation? Yes. Can you take care of the immune system and boost it up? Yes. Can you take care of PTSD? Yes. All with one medicine. So, I mean, if you have one medicine that will do all that versus polypharmacy already, I mean, the weight is there. Polypharmacy, one medicine. Now, certainly you'll have to use different products of that medicine, but if you dial it in, and my usual dial-in is to take CBD dominant tincture 2 to 3 times a day as a loading dose. Depends on what your medical problem is. If you have Crohn's disease, if you have... oh, by the way, I have an event coming up this Saturday. If you guys are interested, those of you who are trying to learn about this, I'm having 4 specialists come in the world of cannabis to take Q&A from everybody at the Endorphin Effect. I'll put a link to the invite list. I think there's 50 people allowed. I don't know if we hit that number yet, but I'll try to put it on YouTube and Facebook. So subscribe to me and you'll see when I put it out. So CBD dominant stuff 3 times a day. And then on top of that, rescue THC dominant, usually for sleep or pain control. During the day, a little bit less of an intense amount, but pain control will be fine too. So if you microdose the smallest possible CBD, the smallest possible rescue, the smallest possible daytime dose, you're good. You continue that. Now, just because we're approving CBD as medicine doesn't mean you're going to walk around with dreadlocks and high all day. I'm sorry, I pigeonholed that. Not that there's anything wrong with dreadlocks, but I think in the 70s and 80s, like, people from Jamaica would be known to have pot, and you can buy it from pot salesmen. And if you ever went to the island of Jamaica, but now obviously it's all over the place, and it's not just that. But I think that's the mindset is you're a pothead, and it's not true. Nowadays there is possibly an addictive or substance abuse problem with cannabis, but for the beautiful value of the other things you can get from the plant, I'd say go for it. So, and then finally, what you have tuned in for, microdosing. Microdosing is not a new concept. It's been there, but the problem with pharmacy is that, if you make a prescription medicine for high blood pressure, there's probably 3 doses, small, medium, and large. If you make a medicine for cholesterol, it's probably 2 doses. So you can't really take apart the capsule and kind of tighter up or tighter down your dose. You are stuck with the specific dose that's being produced by the pharmacy. So if you have even the smallest hint of a medical problem, and it usually, again, cholesterol, blood pressure, diabetes, sleep, erection, if you have even a hint of that stuff, you have to get a pill. And you probably have to get the lowest pill, but that's not microdosing. That's just what's available at the lowest dose. But even with the lowest dose, as some of you know, even with the lowest dose of statin, what do people with statins get? Usually problems with muscle aches, memory. What do people with blood pressure get? Usually erectile dysfunction or depression. So medicines are useful. Don't get me wrong. I have written prescriptions for medicines, but I've written more lifestyle prescriptions than medicine prescriptions lately, because that's just the trajectory I'm at. I want to try to take care of the root cause. I will use the prescriptions in my clinic to extinguish symptoms at that time, but we'll also have to, while getting on a new prescription, have to reverse the disease process so you can let go of the prescriptions. So that's the extra mile I go for my patients. I don't know if other doctors are doing that. I'll go the extra mile with regards to medical cannabis, because I think you can use this one plant to take care of, as I mentioned, seizures, PTSD, sleep problems, inflammation, cancer, nausea, vomiting, seizure, all from one plant. You just have to know how to dose it properly. And those of you who are already on medicines, your doctors, just like Eddie, probably don't know how to wean down your prescriptions while I wean up. I have to work with the other doctors that are giving you medicines. We can enlighten them on how to use medical cannabis properly. If they experience it, maybe they'll get more patients off their medicines, or to me, maybe they'll learn how to use this stuff. But I think it's a win-win if we can all learn to grow with this, the beauty of this plant. But if you have your doctors who have helped you, put them down below. If you just have references that you've used, your books, the Cannabis Index, Cannabis Pharmacy, put them down below, because I'd like to learn what you guys are learning. If you have any questions on what you've done with your dispensary bud tenders, also put them down below and I'll try to answer them. Otherwise, if you're free and you live in the area of DuPage, Cook County, come to the event on Saturday. And if you're not, then subscribe to me and I'll catch you at the next video.